Uterine artery embolization is a minimally invasive procedure most commonly used to treat vaginal bleeding caused by uterine fibroids. In addition, it can also be used to treat vaginal bleeding in emergency situations, for example, due to trauma, malignant gynecological tumors, or PPH. So, what is the definition of uterine artery embolization? It is, in fact, a procedure used to block the uterine artery by injecting polyvinyl particles. What is uterine artery? It is the major blood supply to the uterus arising from anterior deviation of internal iliac artery. This procedure is performed by an interventional radiologist. What are the indications of uterine artery embolization? It is indicated in the patients who want to keep their uterus. Some patients may have tried medications first but not felt relief, so uterine artery embolization is offered to them. It is also offered to the women who are bleeding very heavily after giving birth. Moreover, patients who are unfit for the surgery and patients who are not willing for surgery can also opt for uterine artery embolization. What type of anesthesia is used? It can be done as an outpatient procedure. In most of the cases, a sedative or local anesthesia are given. In this procedure, a percutaneous femoral artery catheterization by making a very small incision is made in the top of patient's leg where her legs meet at her pelvis. The catheter is ultimately passed into uterine arteries which supply blood to the uterus. Small plastic or gelatin particles are put into arteries through the catheter. These particles block the blood supply to the fibroid. When finished, the catheter is removed. Any bleeding from the puncture location is controlled and a bandage is applied. Now, what post-procedure care is provided to these patients? First of all, patient is asked to lie down for several hours after the procedure. Healthcare provider may prescribe pain medications and antibiotic to take at home. Patient can expect watery or mucus-like discharge for several weeks. Moderate to severe pelvic pain are common for the first 24 hours after UAE. Most people can resume normal activities within 1 to 2 weeks after the procedure. Patient may not get her menstrual period for several cycles. In the case of treatment for fibroids, symptoms should begin to disappear in about 1 to 3 weeks. What are the possible complications of uterine artery embolization? The procedure-related complications include groin hematoma, arterial complications, and non-target embolization. Early complications which occur within 30 days include post-embolization syndrome, and late complications which usually occur after 30 days include septicemia, spontaneous fibroid expulsion, fibroid impaction, prolonged vaginal discharge, endometritis, and ovarian failure. 1 to 2% of the patients have post-treatment infection. 6% of the patients require additional procedures. Amenorrhea occurs in 1.5 to 7% of the patients, and emergency hysterectomy is required in 1%. 2.9% of the patients overall may need further treatment like hysterectomy. Now, what is the pregnancy-related complication following uterine artery embolization? In cases of subsequent pregnancy and delivery after uterine artery embolization, there is increased risk of postpartum hemorrhage. The uterine artery embolization is a preferred procedure after failed medical treatment. So, what are the pharmacological agents or medical treatments for the uterine fibroids? Those options include tranexamic acid, mefenamic acid, ulipristal, GnRH agonist, danazol, aromatase inhibitors, and NSAIDs. Here we have general facts about uterine fibroid. The prevalence in lifetime is about 30%. It is 9 times more common in black women as compared to white women. Majority are asymptomatic. 1:4 are symptomatic, and the symptoms depend upon the location. The risk factors for developing fibroids include overweight, nulliparous women, and the genetics. Here we have European Society of Gynecological Endoscopy and FIGO classification for submucous myomas. Here also you can see the leiomyoma subclassification system. So thank you so much. That was all about uterine artery embolization and some facts about uterine fibroid. Subscribe on Obs and Gynae. Allah Hafiz.